The prostate is not usually seen in male cats because of its location within the pelvic canal. In dogs, the prostate is caudal to the urinary bladder. When you finish the exam of the urinary bladder, the transducer should be in a sagittal position over the urethra. We will use the 95-pound Great Dane for the prostate. Remember to keep the organ centered on the ultrasound screen to reduce artifact. With the prostate, it is often necessary to angle the transducer caudally to look under the pelvis. Adjust depth to fill the ultrasound screen with the organ of interest. If needed, adjust transducer frequency for the current depth. Adjust gain for the best image. And adjust focal points to the bottom of the organ of interest. Remember to keep one finger of the keyboard hand on the freeze button ready to capture the best image. When you press the freeze button, practice leaving your transducer hand relaxed and in position so that when you unfreeze you will still have the same image. This will save you time and effort. When finished with the bladder, follow the urethra caudally into the prostate. Remember, you decreased gain in the area of the bladder for that exam, so now you need to return gain to the previous settings. Fan the transducer slightly to one side and then the other to find the widest point of the prostate. Note that I am angling the transducer caudally to look under the pelvic bone. The pelvis is causing the large acoustic shadow caudal to the prostate. Decrease depth to magnify the prostate. Press the freeze button. Use cinematic loop to select the best image and measure the prostate from ventral to dorsal. Label the image and save the image to the patient record or archives. The normal prostate has a thin, hyperechoic capsule and a homogeneous parenchyma. The prostate can be circular or oval in shape. Look for excessive size, cysts, mineralizations, or mixed echoic appearance. Examples of these lesions are shown in the urinary bladder and prostate DVD. The urinary bladder is cranial to the prostate. Measure the prostate width from ventral to dorsal at its widest point. As with adrenals, length of the prostate can vary greatly. I am not aware of a standard table of measurements for the canine prostate. From my own experience, I do not find normal prostates greater than 1.5 centimeters or 15 millimeters in width. As with the adrenals, this is a maximum measurement for large dogs. I expect a smaller measurement for smaller dogs.